Hello, everyone. Our in-service is on the effectiveness of virtual reality for multiple populations. The specific populations we're talking about is Parkinson's disease, vestibular disorder, and Down syndrome. This in-service is done by me, Maxime, and my colleagues Alex and Amy, with contributions from Steve. So what is virtual reality? Well, virtual reality is a three-dimensional computer-generated environment where the person participating places goggle-like equipment on their head, and it encompasses their whole vision, and they're in a new reality. This reality is all computer-generated. This device becomes part of the environment developed by the virtual reality equipment and is able to manipulate objects as well as perform different sort of actions. An example is you can be climbing up a mountain in a scenery, or you could be playing sports. Wherever you are, if you're indoor, outdoor, the new reality is whatever the goggles are portraying. So virtual reality has recently been very useful in rehabilitation or therapy for multiple dimensions. Specifically, it is being used more often with neurointerventions, and it's interactive gaming that is used by the patient to improve their functional mobility, their balance, their coordination, and their strength. It has shown really good research on improving people with functional disabilities to enhance their movement quality.
So the following slide demonstrates an example of how virtual reality can be used for patients receiving rehab. So what populations has virtual reality been utilized with? As demonstrated in this slide, it has been used with individuals with spinal cord injuries, individuals who suffer stroke, as well as amputees and others. Today, we'll discuss its effectiveness for individuals with Parkinson's disease, vestibular disorders, and Down syndrome. So what is Parkinson's disease? According to DeMello et al., it is a neurodegenerative condition that is caused by the loss of dopamine and commonly presents with the following impairments: posture instability, bradykinesia, resting tremors, rigidity, gait impairments, cognitive deficits, and decreased muscular strength and power. 4 randomized control articles were analyzed and demonstrated the effectiveness for utilizing virtual reality for patients with Parkinson's disease. As seen in this slide, the article that states comparison of virtual reality, rehabilitation, and conventional rehabilitation in Parkinson's disease, they gathered 25 males and 26 females to this study and they were around the ages of 71 with the onset of Parkinson's disease around 73 months ago, and were split into 2 groups, the virtual reality group and a conventional group. The outcome measures utilized were the Berg Balance Scale, the Dynamic Gait Index, the DASH, and what they realized with these outcome measures with these patients, or should I say participants, is that the results shown that the gait, balance, upper limb function, mental aspect of quality of life had improved utilizing a virtual reality rehabilitation when compared to a conventional rehabilitation. In another article displayed in the screen, the effects of virtual reality training on walking distance and physical fitness in individuals with Parkinson's disease, they gathered 9 females and 28 males around the age of 60 with stages 1, 2, or 3, according to the Horn and Yard scale, and were split into 3 groups. the virtual reality group, the treadmill group, and conventional group. The outcome measures utilized in the study was a 6-minute walk test to assess distance walk. Results have shown that the virtual reality training is as effective as treadmill training to improve walking distance and gait variables. So now, based on the studies demonstrated in the previous slide, in general, utilizing virtual reality as an intervention for individuals with Parkinson's disease when deemed appropriate can improve gait mechanics, balance, upper limb function, as well as have a positive effect on ADLs and depressive disorder status. However, further research is recommended with a bigger sample size and to assess if those results are maintained over time.
Now that we talked about Parkinson's disease, let's talk about virtual reality and vestibular disorder. Virtual reality can help manage vestibular disorders. As we know, vestibular dysfunction is a disturbance in the body's balance system due to peripheral or central causes. The symptoms of peripheral and central vestibular dysfunctions can overlap, and a proper physical exam can often help differentiate between the two. Signs and symptoms typically consist of vertigo, nausea, vomiting, intolerance to head motion, nystagmus, unsteady gait, and postural instability. Treatment consists of habituation exercises and conventional treatment, as well as virtual reality and augmented reality. Today, we talk about how virtual reality and how that can further enhance one's rehabilitation process. Research on virtual reality has shown that interactive video gaming systems that are linked to an aerobic training regimen increases adherence to therapy exercises more than just an aerobic training regimen alone. Patients that receive virtual reality rehabilitation exercises have shown to decrease dizziness significantly more than traditional vestibular rehab exercises. When looking at static and dynamic virtual reality exercises, there is more of an effective treatment when patients are using dynamic virtual reality exercises. According to Heffernan et al., virtual reality has shown to improve DHI and balance confidence, aka ABC scores, more than a traditional rehab program. Overall, virtual reality has shown to improve DHI and ABC scores greater than 3 months post-intervention. While virtual reality has its excellent outcomes, research shows that the best way to treat a patient is by using virtual reality with other conventional and/or habituation exercises.
So now we're going to talk about virtual reality in Down syndrome. And just a refresher, Down syndrome is a genetic condition where the individual diagnosed has an extra chromosome or chromosome pair 21 that can lead to specific mental, cognitive, and physical characteristics. These physical characteristics can be developmental delay or motor deficits, such as coordination issues, balance problems, strength deficits, etc. And outside of virtual reality improving these developmental delays and motor deficits, it is also shown to improve motivation and self-efficacy with children with disability and improve their quality of life. And it's also a fun way for them to laugh and enjoy themselves. So these are the important research that I found on virtual reality and the effects on Down syndrome. The first one was these children aged 7 to 14 had 16 sessions of virtual reality using the outcome measures KTK, which is a coordination-based outcome measure, and PBS, which is a balance-based outcome measure. And they found over 4 weeks that it substantially improved their balance and coordination. The next research article was done on 105 children aged 7 through 13, where they had 48 sessions over 24 weeks, and they compared it to just basic occupational therapy. And the outcome measures they tested was the shuttle run and BOT2. And the results showed that virtual reality increased their walking speed, agility, and motor coordination over those 48 weeks over just regular occupational therapy exercises. And then the last article I found is the efficacy of virtual reality based on children and 10 through 13, more in their teens, and there was 30 participants where they had 12 sessions over 6 weeks, and it was comparing virtual reality versus conventional PT, and the outcome measures they used was just a GMQ. And for both groups, they found that there was improvement in balance, but virtual reality actually had more overall improvement compared to just a conventional physical therapy group. So virtual reality does have a great impact on the quality of life for children with Down syndrome and their just overall functional potential.
So after looking at all of the research and the findings summarized from the project, we can begin to look at how to put these lessons into practice at West Gables Rehab Hospital. At West Gables, recently you guys acquired both augmented reality in the form of a treadmill with a projector that provides visual obstacles and cueing, as well as the Virtualis, which is a 5 VR system with rehab software. The results from all of these studies are very promising, but also suggest that further research is warranted. With regards to Parkinson's, virtual reality and augmented reality has been shown to have the potential to have a greater impact than conventional therapy. We are likely all aware of the benefit of Parkinson's patients benefit from bright, easily visible visual cues and noises such as metronomes to initiate movement. This bodes quite well for the CMIL AR system, in particular to provide gait training. West Gables would benefit from standardizing the BBS and the DGI to track patient outcomes when using these systems. Vestibular results are a little more mixed, but also hold that there is a potential to provide significantly better and beneficial and long-lasting outcomes. Vestibular conditions are not a single diagnosis, even though they were grouped together for a study within the VR research. But as such, they will likely warrant more careful selection of particular VR programs for treatment. Some of the most common outcome measures are DHI and the ABC. When looking at Down syndrome is a less common diagnosis at West Gables, and having experienced one patient at West Gables during my time at West Gables for my internship, we have had them in the past where they would go into behavioral rounding. And as per Steve, he has seen 2 to 3 cases, and they also have used behavioral rounding in the past. The study suggests promising results for balance, but should be discussed in behavioral roundings when applicable, and also discussed with clinicians who have had experience with Down syndrome. The setup of equipment can feel particularly burdensome, and if a patient is unable to process the benefits of the exercise, it may cause greater distress than benefit. However, it appears that when appropriate, VR and AR can be a very useful tool for treatment. In conclusion, the virtual reality we see can have a huge impact to improve motor deficits in patients with many neurological conditions and disorders. When implementing VR to a Parkinson's patient, it can assist improving their gait mechanics, balance, upper limb function, as well as have positive effect on ADLs and depressive disorder state. VR is a safe and effective treatment for managing vestibular patients. It is important to know that it can improve their overall dizziness, balance, and coordination to be able to improve their overall function in daily activities. When looking at Down syndrome, VR has shown to improve balance, gait, and coordination for the Down syndrome population, ages 7 to 15. Thank you for listening to our presentation. I hope you guys have enjoyed and found it informational. These are our references.